Import the case into the GPS system and select the appropriate implant. Use the adjustment features on the screen to plan the tibial implant's placement per the patient's anatomy. Toggle the 3D CT button to enter a CT view. Tap the arrow buttons to progress through individual CT slices. Insert the batteries, positive end first, into each of the trackers. Pair the trackers to the station. Next, calibrate the trackers. You will hear an audible tone when it's successfully calibrated. Place two 2.4 mm threaded pins into the tibia and 2 more into the talus using the pin guide. Confirm bicortical placement with fluoroscopy. Attach the bone fixator to the pins and the T-tracker to the tibial bone fixator and F-tracker to the foot bone fixator. Position the tracker parallel to the table and lightly tighten the fixator with the hex driver. Perform the tibial acquisitions. For point acquisitions, place the probe tip on the anatomic landmark, then press and release the forward button on the probe. For patch acquisitions, place the probe tip on the anatomic landmark, press and release the forward button, and then paint the anatomic reference according to the figure displayed on the screen. Do not hold the button down during acquisition. Next, perform the talus acquisitions. The system will digitize the acquisitions and generate another color map of the points for verification. Acquire the neutral position data point to define the neutral orientation of the talus. Develop a preoperative laxity curve by repeatedly moving the foot through a full range of motion while varying the varus valgus position. Use the medial shim to align the tibial tubercle pin. Then place the pin into the tibial tubercle and through the proximal hole in the total ankle alignment guide. Insert the tibial cut block into the alignment guide. Then, insert the tibial cut tracker into the tibial cut block and attach the G-tracker. Before making your tibial cuts, review the cut locations on the screen indicated in blue. If you need to adjust your planned cuts, select the Review Plan button and follow the appropriate steps. Use the adjustment features on the alignment guide to match the cut location with the planned cut location, indicated in white. When the tracked cut location is within 1 mm and 2 degrees of the planned cut, the cut line will turn green. Pin the alignment guide. Remove the tibial cut tracker from the cut block and perform tibial cuts according to the vantage ankle technique. Check the cut position and orientation by attaching the G-tracker to the cut checker. Press the face marked tibia against the resected surface of the tibia. Once the tibial cut location and orientation are confirmed, advance to the tailor cut planning screen. Position the planned cut using the translation and rotation buttons. Insert the adjustable tailor cut block into the alignment guide, then insert the cut tracker into the cut block and attach the G-tracker. Ensure the paddle is contacting the talar bone. On the screen, the tracked cut location is shown as a white line and the planned cut location is blue. When the tracked cut location is within 1 mm and 2 degrees of the planned cut, the cut line will turn green. Then, pin the alignment guide and adjustable tailor cut. Remove the tailor cut tracker from the cut block and insert the angel wing. Verify the cut position and orientation with fluoroscopy. Make the tailor cut according to the vantage ankle technique. Connect the G-tracker to the cut checker. On the screen, a white line will show the cut's true location. Once the performed cut and the planned cut are aligned, the cut's location line will turn green. Implant the vantage ankle implant per the specified technique. Develop a postoperative laxity curve by repeatedly moving the foot through range of motion while varying the varus-valgus position. The preoperative and postoperative acquisitions are shown for comparison. Complete the surgery by following the remaining steps in the respected vantage angle technique.